Well, and so if we then move on, if we well, clearly we're staying around the hip joint for the duration of this conversation, but if we move on to other implant related issues that can potentially occur, you mentioned fracture, sort of a break in the bone.
Yeah.
How would you, what sort of points would you touch on there typically in a clinic? And I guess we can expand on as you said here.
Yeah, so I mean, obviously, I generally say that whenever you operate on bones, obviously there's a risk of fracturing them. You know, using power tools, you're using mallet, during the surgery, and there is a risk of fracture. It's pretty low, kind of, like, 1 in 500 or something like that sort of kind of risk of having a problem. If there is a problem during the operation, and you notice it, obviously, you do something about it. So you sort it out at the time, whether that's you need to fix the fracture, or whether that means you need to use a different kind of implant. That's resolved at the time. If a patient has a fall after their surgery, kind of any time after surgery, we talked about falling down the stairs or whatever, if you injure yourself severely, there's a chance you might fracture the bones around the hip replacement, in the same way that you might fracture the bones on the other hip. But the kind of fracture you get is different because of the hip replacement being there. I mean, it's quite common that a fracture around a hip replacement would require an operation to kind of put that back together and fix it, or even to revise the hip to get the patient back walking again.
Right. Okay.
That does, often that's the chance of that happening can sometimes go up as the years go by. So if there starts to be a problem with a bit of loosening, or the bone becomes a little bit weaker, then the chance of fracture starts to go up a little bit.
Yeah. And I guess as with all risks and complications, it will also be dependent on personal factors and bone strength and
absolutely, yeah.